Welcome back to Elevate Care. I'm your host, Kerry Perez. Today, we're sharing a conversation with AMN Healthcare leaders JB Tanner, Vice President of RPO, and Taryn Coates, Vice President of Business Development. They're breaking down how Recruitment Process Outsourcing, RPO, has become a scalable, strategic solution for healthcare organizations navigating expansion. You'll hear how RPO enables health systems to offload the complexity of high-volume hiring to dedicated experts, helping them grow faster, stay compliant, and meet critical deadlines. In this episode, JB and Taryn walk through a major project with the Southwest Health System preparing for a $200 million tower addition. The organization needed more than 400 hires in just 8 months, including highly specialized pediatric roles, while meeting strict quality and regulatory requirements. They discuss how AMN supported the project with a dedicated pediatric recruitment team, detailed workforce planning, multi-channel outreach, and integrated technology that provided real-time transparency. And the results were impressive. 95% of critical roles filled ahead of deadlines, time to fill reduced from 78 days to 47, $2.3 million in labor savings, and a 35% lower cost per hire, strong retention and patient satisfaction, full regulatory compliance, and an on-time launch. And if you'd like to explore this case study even further, we've included a flipping book resource in the show notes. All right, let's dive into the conversation.
My name's JB Tanner. I'm joined by our guest, Taryn Coates. Today's topic is how to staff new builds and hospital expansions. Taryn, you led the recruiting team. From your perspective, tell us about the project and where your team was able to fit in.
Yeah, so the project was specifically focused on the expansion within Plano. And so that's really where my team prioritized their time. I think naturally with the excitement of the expansion, you saw some internal transfers. So not just the natural employee turnover, but due to interest to the new expansion, there was some internal turnover at Dallas with individuals expressing an interest to move over to the new project and the new units. But I think the biggest focus was just ensuring that the team prioritized their time and energy in alignment with the timeline set in place. So we had an overall go live date, but given the structure of some of the teams, some were ready to start sooner rather than later. Some were looking for staff following the go live date. And so it was just ensuring that our recruiters were in alignment with what made the most sense for the business.
Well, and what I remember about that project was how important it was to coordinate communication and make sure that they really work very closely with the internal talent acquisition team and the AMN team to make sure we're all getting the information. Taryn, RPO, we've said it a few times. Can you tell me what is an RPO?
Yeah, so it's an acronym for Recruitment Process Outsourcing. I think the biggest differentiator versus your traditional direct hire staffing, that's more outside vendor or agency style, is us actually integrating into the system, following their processes, and really just kind of immersing ourselves in the culture. I think the biggest key call out as well is from a candidate experience level. Candidates have, their experiences. I'm working with a recruiter. I'm not working with AMN Healthcare. And I think the biggest difference is just the overall candidate experience, because we are truly committed to aligning ourselves with the organization's overall strategic initiatives, but also culture, which I think is the biggest piece.
Why do you think it's important, or what kinds of things do you take into consideration when choosing to go RPO versus building internal, and what are the advantages?
Yeah, I think in particularly speaking to expansions, it's a period in time. It's not, is there an influx and obviously the demand on the talent acquisition team, but it's very short-lived if you look at the grand scheme of things. And I think the biggest just component of utilizing an RPO is the scalability. And so it's the ability to just add recruiters much more quickly, but at the same token, as the project is starting to come to a completion, start to scale back on the recruitment team in alignment with those timelines. And then it all falls on our hands, right? You don't have to be the individuals to go through any type of workforce reduction within the TA team. I think another big piece that comes with the RPO team is just the experience in having worked with multiple health systems. Obviously, it's great when individuals have tenure with an organization, but I think that there's a lot of value in having a partner that's kind of seen what other health systems are doing and kind of bring in some best practices from across the nation, either with similar health systems or ones that are maybe a little bit different, and kind of bring some fresh eyes. And so I think that's a big component that you get when utilizing an RPO.
Yeah, you took the words out of my mouth. But it's also, they gain experience recruiters too. They've worked with other health systems, but they've done other build outs oftentimes too. As health systems are evaluating RPO partners for new builds and expansions, what is some of the return on investment and cost savings they can expect?
Right. So a huge priority kind of coming off COVID is, the cost differentials between contingent labor and their core staff. And so I think, proactively planning out these expansions and forecasting and mapping it out to ensure that there isn't a high utilization spike on the contingent labor side can ensure that there's an ROI cost savings investment. I think on average, it's about 30 to 50% from a contingent labor viewpoint.
Yeah, I would say premium labor. So that's one thing when we're looking at the cost per hire for a health system internally versus maybe utilizing a partner. You look at the cost of premium labor, which could be internal float pool, it could be PRN, it could be travelers, and really try to optimize that mix of premium labor to core staff labor. But when you're looking at an expansion like this, you're trying to avoid dipping into premium labor. Okay. So you've got these deadlines. And a lot of times they're really concrete. Like, this is the day we're opening. Here's when floor 1 opens. Here's when floor 2 opens. And you need to have that staff built out without either pulling from the other locations or pulling in premium labor, which just drives the cost of the project up.
Right.
When I think about RPO's benefit, though, it's efficiency. So even though if you look apples to apples at what it might cost to bring in a contract recruiter compared to an RPO, it's the efficiency that the team as a whole can bring.
I think one of the benefits of AMN is AMN has a national scale grasp. And so in partnering with us and, just the access to candidate pipelines and databases, even through our travel partners, right? And kind of tapping into individuals that maybe traveled for a few years coming off COVID and they're burned out. And we can utilize that same candidate talent pool outside, even not just the Dallas market, but the Texas market as well, and work to lure them in. Dallas is a super appealing market. We've seen a lot of migration from some of the states that the cost of living is higher. And so it was a little bit more of an easier sell to certain candidates to bring them into the Dallas market. But I will say that we did have, quite a bit of success in kind of pulling talent from outside the area and bringing them in to ensure that we met those headcount numbers.
Well, I think when you shift to pediatrics recruiting, yes, Dallas is a large metro, but the number of experienced pediatric providers is still limited. And it's important to be able to tap into areas similar to Dallas and other parts of the country so we can pull in some of the super subspecialized pediatric providers.
Pediatrics, and I would say obstetrics as well, are in high demand from a recruitment perspective. Many nurses have a desire to kind of move into working with that type of patient population. But on the flip side, more often than not, they are required to have that specific experience with those patient populations. And so it's finding the balance of, obviously there's a high demand from the available candidate pool and wanting to move to work with those patient populations, but oftentimes they will require already having obtained that experience already. And so I think that's super critical that the recruiters kind of tap into identifying individuals that have worked in similar settings and not just kind of working off, the overall desire of clinicians.
Going back to the ROI piece, Taryn, you brought up external candidates and the value of bringing candidates that maybe the organization wouldn't have already had. And I think this is a challenge sometimes when healthcare organizations are evaluating an RPO. Oftentimes they think of staffing organizations as more of an agency or a direct hire vendor. One thing that's unique about the recruitment process outsourcing model is that you hand over a department, a specialty, a location. That's really where you get the scalability and the efficiency. And the RPO recruiters they build a relationship with those hiring managers. They understand the requirements of the roles, and they're able to move the puzzle pieces around, whether they're promotions or internal transfers or external applicants or direct applicants that maybe the organization would have already had. The pricing, the cost of the service assumes that. So pricing often in the cost per hire is less than what it would be in a more traditional agency relationship.
Exactly. Obviously that's a call out that, we've discussed with past and current partners. And that's why I like to ensure that the RPO experience that we're providing is more of that agency style experience. And so I always joke that, you get agency experience for an RPO pricing. But I think it's, what you called out, GB, is super important is not only, are we looking at the internal transfers and managing of the applications that are flowing in through the careers page so there isn't any disruption in the process internally, but it's also, the requisitions or the focus areas that don't have that high demand or that natural attraction to candidates that are more assertive is ensuring that our recruiters are going towards the passive candidate pool to fill the gaps. I think to get the most out of an RPO program is to ensure that you're aligning the RPO recruiters on those high priority areas. I'm always the first to say PCTs is usually, a quick call out. That'll drive, huge application flow. We saw at the on-site career event too that there was a huge turnout for PCTs just in general. And so for you to get the most out of the RPO experience and what we're providing, doesn't make sense to necessarily focus RPO in the areas of such as the PCTs for that reason. It's to, put us where you're struggling. There's been an increase in the last year in just allied clinicians overall, but the supply still remains pretty, dry in comparison to the number of openings available on the market. And so I think it's critical that the RPO recruiters are spending their time on physical therapists and, radiology has been a huge call out recently for many organizations, especially because it tends to be the highest revenue generating for a hospital. And so it's critical that, those units stay staffed from a financial perspective. And so I think that's going to be the biggest piece with RPO as well.
Well, this year's been tough on a lot of new builds. And I think of it really the trifecta of a reduction in the research dollars. And this has impacted academic health centers mostly, but then there were concerns over just the costs of the goods that hospitals are using and what tariffs might do for them. And so this topic, I feel like, is topical, well, timely, because as we roll into the next year with new budgets and hopefully with a little bit more stability in funding, we expect there to be more expansions and new builds in the next 12 to 24 months. We know how to staff the expansions and new builds. So as we start to come into that, and talent acquisition leaders are planning on how they're going to accomplish this goal, many times with fewer full-time talent acquisition staff than they had a year ago, we can really step in and fill that gap.
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.